Hey guys, it is your favorite Medicare guy, Ken here, and we're going to be talking about a very big developing whistleblower scandal in regards to Medicare. So we got some more Medicare news coming your way. So this is from KFF Health News, Kaiser Family Foundation, incredible source of information when it comes to health-related news and everything like that. So the article, whistleblower accuses Aledade, largest U.S. independent primary care network, of Medicare fraud. This is huge. Medicare fraud is obviously nothing new. It is huge. We spend billions of taxpayer dollars every year on Medicare fraud. It is definitely something that needs to get rung in. But what's crazy is, I think when we think about Medicare fraud, and a lot of times we think of like some random person or doctor doing it, this is one of the largest healthcare companies in the country committing massive amounts of Medicare fraud, according to this lawsuit. So we're going to dive into it. Again, this is a developing story. Some things might change, but this is the lawsuit and what we know so far. So let's dive into it. A Maryland firm that oversees the nation's largest independent network of primary care medical practices is facing a whistleblower lawsuit alleging it cheated Medicare out of millions of dollars using billing software rigged to make patients appear sicker than they were. The civil suit alleges that Aledade Inc.'s billing apps and other software and guidance provided to doctors improperly boosted revenues by adding overstated medical diagnoses to patients' electronic medical records. So things like Medicare or any condition really in insurance, you get paid specific amounts for the things that you do. So if you go in and it's like a normal primary care visit, so if you're a medical office, you get paid for specific procedures. You know, each thing has its own general price. A primary visit, a vaccine, blood drawn, whatever it might be. The insurance companies and Medicare say, here's how much you can bill for this specific thing. What these people are saying is Aledade is rigging their software to automatically bill things that did not happen, or to escalate claims and say this person got more care than they actually did. So this is a huge accusation. We've heard about this in spaces before, especially in the Medicare Advantage space, where companies say like a huge amount of their enrollees are diabetic or whatever it may be. And it's a huge deal. So we're going to see where this goes and talk about how Aledade is potentially doing this. Quote, Aledade did whatever it took to make patients appear sicker than they were, according to the suit. For example, the suit alleges that Aledade conflated anxiety into depression, which could boost payments by $3,300 a year per patient. And Aledade decided that patients over 65 years old who said they had more than one drink per day had substance abuse issues, which could bring in $3,680 extra per patient, the suit says. All right, so there's two levels to how messed up this is. The first level is they're getting a lot more money for lying on records. And this is going into taxpayer funds. This is becoming a big issue because they're getting more money than they should. So on a macro level, they're getting a lot of taxpayer dollars and forcing the price of healthcare to go up because they want more money for things that didn't happen. What's even crazier, on an individual level, maybe you say, well, I don't really care about that too much. The government spends money regardless. What you should know is if they adjust your records falsely, it could really affect you down the line. So let's say you have anxiety, and Aledade says that you're actually depressed. Well, depression in life insurance screenings, in most cases, is more seriously looked at compared to anxiety. That's just my experience. It could be different depending on the company. If Aledade writes in your medical records without you knowing that you are depressed, you could face issues trying to get an affordable life insurance policy or just getting life insurance in general, because a lot of places view depression quite negatively. This could also affect you if you're trying to switch Medicare supplements at some point, because you do have to go through underwriting, and a lot of different Medicare supplement providers also do not favor depression, and they look at it as a pretty serious medical condition. So without you even knowing, your medical records could be altered and you could face negative consequences on top of all the tax money lost in this Medicare fraud scheme that is being alleged. Also, one drink per day, had substance abuse issues. Again, that's huge. Whether you're trying to get life insurance, whether you're trying to switch supplements, whether you're trying to do anything, if you have substance abuse on your record, that is going to be a huge red flag for most insurers, you know, healthcare providers, all that stuff, for only one drink per day. That's crazy. That's really not that much. So this is big on a macro and micro level. The whistleblower case was filed by Kushwinder Singh, my apologies if I mispronounced that, in federal court in Seattle in 2021, but remained under seal until January of this year. Singh, a senior medical director of risk and wellness product at Aledade from January 2021 through May 2021, alleges the company fired him after he objected to its fraudulent course of conduct, according to the suit. He declined to comment on the suits. So Mr. Singh here is saying, I was here for 4 or 5 months and I realized very quickly that they were doing fraudulent things. And I got fired for bringing it to people's attention. I'm now trying to sue to get some recourse for that. The case is pending, and Aledade has yet to file a legal response in court. I might butcher this name as well. Julie Bataille, Aledade's senior vice president for communications, denied the allegations, saying in an interview that the whole case is totally baseless and meritless. Based in Bethesda, Maryland, Aledade helps manage independent primary care clinics and medical offices in more than 40 states, serving some 2 million people. We obviously need to see the proof that Mr. Singh has for this lawsuit, but I mean, this is huge. 2 million people potentially have had their medical records altered because they are all under this Aledade umbrella. Aledade is one of hundreds of groups known as accountable care organizations. ACOs enjoy strong support from federal health officials who hope they can keep people healthier and achieve measurable cost savings. We're going to talk about ACOs a little bit more at the end of this, but remember that term, ACO, Accountable Care Organizations. Aledade was co-founded in 2014 by Farzad Mostashari, a lot of tough names in this one, my apologies, a former health information technology chief in the Obama administration, and has welcomed other ex-government health figures into its ranks. In June 2023, President Joe Biden appointed Mandy Cohen, then executive vice president of Aledade, to head the Centers for Disease Control and Prevention in Atlanta. So a former Aledade employee is heading the CDC. So that's pretty crazy. It's all, they call it the government revolving door, where people become executives and they work at the government, then they go back to being executives. Aledade has grown rapidly behind hundreds of millions of dollars in venture capital financing and was valued at $3.5 billion in 2023. So that's pretty crazy. This company is getting huge. It has a lot of federal support. It has a lot of people inside the government. Aledade is growing fast. Mostashari, Aledade's chief executive officer, declined to be interviewed on the record. Obviously, this lawsuit's pretty new. I don't think either side is going to say much to the media at this point. As said in this, as this is an active legal matter, we will not respond to individual allegations in the complaint, Aledade said in a statement to KFF Health News. We remain focused on our top priority of delivering high-quality, value-based care with our physician partners, and will defend ourselves vigorously if needed in a court of law. The lawsuit also names as defendants 19 independent physician practices, many in small cities in Delaware, Kansas, Louisiana, North Carolina, Pennsylvania, and West Virginia. According to the suit, the doctors knowingly used Aledade software to trigger illegal billings, a practice known in the medical industry as upcoding. None has filed an answer in court. So what Mr. Singh is alleging in this lawsuit again is that all these people knowingly billed the wrong thing so they could get more money. And I mean, in a very messed up way, it makes sense, because you go and you say, I have a headache, and they ask you a bunch of questions and they say, you know what, just get more sleep, drink more water, drink less caffeine, whatever. But then they say, oh, he's depressed. You came in there, you didn't really need that much work, but they got $3,600 out of you. So they're alleging this is a scheme to get more Medicare money, more insurance money for less work. And they're saying not only did this huge conglomerate Aledade do it, but a lot of their doctors knowingly did it as well. They were in on the scheme. So again, huge allegations. This is a new lawsuit, but the allegations are pretty serious, and we obviously have to see how this plays out. More than 24 whistleblower lawsuits, some dating back more than a decade, have accused Medicare health plans of overcharging the government by billing for medical conditions not supported by patient medical records. These cases have resulted in hundreds of millions of dollars in penalties. In September 2023, Cigna agreed to pay $37 million to settle one such case. For instance, let's dive into this real quick. Justice.gov, United States reaches $37 million settlement of fraud lawsuit against Cigna for submitting false and invalid diagnosis codes to artificially inflate its Medicare Advantage payments. I mentioned earlier in the article, we saw a lot of stuff like this where Medicare Advantage companies were falsifying patient records. I'm going to be totally honest, 37 million, not a huge fine. I'm sure Cigna made way more than this in the false coding. So this is one of those like cost of doing business fines where they probably ended up making out like bandits instead of, this settlement. So that is definitely tough. I think these fines need to be much higher if we're going to be talking about actually curbing these unethical practices. I will leave this article in the About section below if you want to dive into this Cigna article, but there's a lot of cases like this in the Medicare Advantage space. Back to the Aledade article, but the whistleblower suit filed against Aledade appears to be the first to allege upcoding within accountable care organizations, which describe part of their mission as foiling wasteful spending. That's pretty ironic that the whole point of these organizations is to cut spending and be more efficient, and they're purposely doing more waste. They're purposely, doing the exact thing they're designed to stop. ACUs, including Aledade, made headlines recently for helping to expose an alleged massive Medicare fraud involving urinary catheters. I'll link this. I couldn't get through the paywall, but there was like a $2 billion Medicare fraud catheter scam that came out. Again, crazy stuff. The level of Medicare fraud that people do is crazy. Finding the gravy. Sing's suit targets Aledade's use of coding software and guidance to medical practices that joined its network. Some doctors treated patients on standard Medicare through the ACO networks, while others cared for seniors enrolled in Medicare Advantage plans, according to the suit. Medicare Advantage is a privately run alternative to standard Medicare that has surged in popularity and now cares for more than 30 million people. Aledade has sought to expand its services to Medicare Advantage enrollees. The lawsuit alleges Aledade encouraged doctors to tack on suspect medical diagnoses that paid extra money. Aledade called it finding the gravy sitting in the patient's chart. So this lawsuit isn't just saying they did it without doctors knowing. He also alleges that they were training doctors on how to get away with this as well. And it's happening in both Medicare and Medicare Advantage, which is important, which we'll dive into in a little bit after I get through this article. The company instructed providers to diagnose diabetes with complications, even if the patient's diabetes was under control or the complicating factor no longer existed, according to the suit. So again, upcoding. Maybe someone has pre-diabetes, maybe their diabetes under control. What Singh is saying is the company told people, make everything seem worse than it is so we can get more money for these different things. Some medical practices in Delaware, North Carolina, and West Virginia billed the inflated code for more than 90% of their Medicare Advantage patients with diabetes, according to the suit. The lawsuit also alleges that Aledade rigged the software to change a diagnosis of overweight to morbid obesity, which could pay about $2,500 more per patient. Some providers coded morbid obesity for patients on traditional Medicare at 10 times the national average. Jesus. This fraudulent coding guidance was known as Aledade Gospel, according to the suit, and following it paid dividends in the form of millions of dollars in increased revenue. These tactics usurped the clinical judgment of doctors, according to the suit. This is pretty crazy. I mean, again, this is allegations. This is a lawsuit that just opened up, but this is nuts. This seems like a very high level scheme to get people to get more money for this ACO Aledade. We're going to keep you up to date on this as it continues to develop. No diagnosis left behind. In its statement to KFF Health News, Aledade said its software offers doctors a range of data and guidance that helps them evaluate and treat patients. Aledade's independent physicians remain solely responsible for all medical decision-making for their patients, the statement read. The company said it will continue to advocate for changes to improve Medicare's risk adjustment process to promote accuracy while also reducing unnecessary administrative burdens. Again, these ACOs were created to make sure that there was more accuracy and less fraud, waste, and abuse. And it is doing the exact opposite, according to this lawsuit. So this is pretty crazy. In a message to employees and partner practices sent on February 29th, Mostashari noted that the Justice Department had declined to take over the False Claims Act case. We recently learned that the federal government has declined to join the case U.S. ex rel. Kushwinder Singh versus Aledade Inc. That's good news and a decision we wholeheartedly applaud given the baseless allegations about improper coding practices and wrongful termination brought by a former Aledade employee 3 years ago. We do not yet know how the full legal situation will play out, but we'll defend ourselves vigorously if needed in a court of law, the statement said. The Justice Department advised the Seattle court on January 9th that it would not intervene in this case at this time, which prompted an order to unseal it, court records show. So the Justice Department is not throwing their weight into this case, which a little disappointing in my eyes. I'd like to see them at least double check. Again, we don't know if this is true or not, but I'd like to see the Justice Department get involved. Under the false claims law, whistleblowers can proceed with the case on their own. The Justice Department does not state a reason for declining a case, but has said in other court cases that doing so has no bearing on its merits. Singh argues in his complaint that many unsupported diagnosis codes were added during annual wellness visits and that they did not result in the patients receiving any additional medical care. So again, you go to your, once a year checkup, they say, okay, you're fine. But then they write down, oh, you're depressed, you're diabetic, you're overweight, all those things, and they get a lot more money. Aledade maintains Slack channels in which doctors could discuss the financial incentives for adding higher paying diagnostic codes according to the suit. Those would be pretty damning if they did come out. The company also closely monitored how doctors coded as part of an initiative dubbed No Diagnosis Left Behind, according to the suit. So I will link this article below. This is crazy. I want to talk a little bit about ACOs. Aledade's obviously one of the bigger ones, but this whole concept of ACOs is a little bit scary, to be honest, because one of the main pulls of Original Medicare is a very robust network of doctors, pretty much no prior authorizations or pushback or referrals or anything like that. And that's why a lot of people stick with Original Medicare as opposed to a Medicare Advantage plan where those things are a bit more commonplace. ACOs are looking to reverse that even within Original Medicare. A lot of these ACOs are hospital systems and primary care systems where these doctors and hospitals bundle together to create a cohesive unit. And in many cases, they monopolize or, very heavily consolidate medical care in a specific area. One of the examples we have is a healthcare system called Novant, which is primarily based in North Carolina. And we have clients down there who have had to get prior authorizations and referrals on Original Medicare when dealing with Novant, which is unheard of. It had never really happened until the past year or so when these ACOs started getting more power. But Novant is pretty much every doctor in a hospital in North Carolina, or a very large percentage. I shouldn't say every, but a very high percentage of the hospitals and surgeons and everything. So the whole point of Original Medicare is there's no pushback that you'd normally get with an insurance company. And I talk about Original Medicare, and these ACOs are really starting to threaten that on a big level. Also, a lot of these ACOs might have sweetheart deals with certain insurance companies. So they want you to go with a specific Medicare plan or Medicare Advantage plan. So it's pretty scary, to be honest. Like, we're not a big fan of these ACOs. We want Medicare to have its teeth and people to not need prior authorizations and referrals, especially if, based on these allegations, these ACOs are doing all the things they were intended to stop. So we're going to keep following this story. I imagine this lawsuit will, go through many years of things that it has to do, but we will stay on top of it for you. If you want to stay on top of all the Medicare news, please like and subscribe to our channel. We are NJ Life and Health. We're a Medicare brokerage based in 24 different states, but we are based in Toms River, New Jersey, where we are happy to help you out. If you have any questions, concerns about Medicare or life insurance, we have a bunch of great other educational content on our YouTube channel. And you can always call us at 848-226-6897 or visit our website at www.njlifeandhealth.com. So let us know in the comments what you think about these allegations, about this lawsuit, what the future of Medicare is under ACOs. And if you have any other topics or news articles you'd like us to cover, just leave us a comment and we will see you in the next video.